The Research and Surveillance Centre's mission is to provide high-quality data for the purposes of surveillance, quality improvement, research and education to support public health and direct patient care.
The RSC has been the primary source for disease surveillance in England for nearly 60 years now. We have over 2,000 practices across the network. Those practices support the monitoring of 30 infectious diseases that are circulating in the community. That data is then produced in a report that's made publicly available and provided to different health bodies on a weekly basis.
The RSC has 3 key work streams. Data management. Data, which are coded into patient medical records by the GP or healthcare professional in the practice, are extracted and immediately pseudonymised. The data are stripped of any direct patient identifiers and fed into our database where it's held securely. The data are fed through to UKHSA to support early warning systems in outbreak detection, used to create public communicable and respiratory disease reports, update the online dashboards and observatories where the practices can see what diseases are currently most likely to be affecting their local community. Sampling. Many RSC network practices take part in serology and virology sampling to support understandings of vaccine effectiveness. Virology sampling involves taking a nose and throat sample from a patient suffering from an acute respiratory illness. The sample gets tested at a UKHSA lab and the result is sent back to the practice. Virology sampling helps to monitor which viruses are circulating in the community and supports vaccine effectiveness. Serology sampling helps to monitor disease exposure and immune response, for example, to seasonal flu and COVID-19 vaccines. We have a dedicated team of practice liaison officers that provide training to practices on patient eligibility, informed consent, high-quality coding, and how to order sampling kits. Research. Our database is a resource for UK-wide health research and is a trusted research environment. Our themed datasets are used to undertake health research trials and studies. Practices within our network will also receive calls for specific research studies which they can support from within their practice. RSC practices have the flexibility to participate in as many or as few work streams as suit their capacity and priorities. Each work stream offers compensation to recognise the time and effort practice staff contribute to supporting the RSC's mission. We are clinician-led and seeking to expand our collaborations. We welcome more practices to join our network. Together, we can drive meaningful change, inform public health policy, and shape the future of patient care.
Within the team, I lead on patient and public involvement work, and this involves meeting with and consulting with a group of public contributors. So we typically would speak to them on a quarterly basis or sometimes more frequently, and this is to kind of gain their perspectives on the sampling that we do as part of our surveillance work, as well as in planning any research studies as well.
The Practice Liaison team offers a dedicated bespoke service. We really like to get to know our member practices and support them in their research and surveillance efforts. We're on hand to help, so please contact us today if you'd like to learn more. To learn more about how your practice can get involved, contact the RSC Practice Liaison team. Thank you for your contributions. Let's work together to make a lasting impact.